How does an echocardiogram bubble study reveal PFO for stroke? Imagine trying to find a hidden doorway in a house. A bubble study is like shining a flashlight through that doorway to see if it's open. It helps doctors see if a small opening in the heart, called a patent foramen ovale, is there and if it could be causing strokes. A patent foramen ovale is a tiny flap-like opening between the right and left upper chambers of the heart. It's normal in fetuses but usually closes after birth. Sometimes it stays open in adults without causing symptoms. But if a blood clot forms in the veins, it can travel to the heart and then through this opening. If it bypasses the lungs, which normally filter out clots, it can reach the brain and cause a stroke. This is called a paradoxical embolism. The bubble study uses a special saline solution mixed with tiny air bubbles. These bubbles are injected into a vein in the arm. Normally, they travel to the right side of the heart and then to the lungs, where they are filtered out. But if there's a PFO, the bubbles can cross directly from the right atrium to the left atrium through the opening. This crossing can be seen on an ultrasound image. There are two main types of ultrasound tests used. The first is a transthoracic echocardiogram, which involves placing a probe on the chest. It's less invasive but sometimes less sensitive. The second is a transesophageal echocardiogram, where a probe is inserted into the esophagus, giving a clearer view of the heart and the atrial septum. This method is more sensitive and often used if the first test doesn't give clear results. During the test, the patient may be asked to do a Valsalva maneuver, which involves trying to exhale forcefully with a closed mouth and nose. This increases pressure in the chest and temporarily raises the right atrial pressure, making it easier for bubbles to cross if a PFO is present. The doctor watches the ultrasound images closely. If bubbles appear in the left atrium within a few heartbeats after injection, it indicates a shunt or passage through the PFO. The number of bubbles crossing can tell how large the shunt is. A few bubbles suggest a small opening, while many bubbles indicate a larger one. This information helps determine the risk of stroke and guides treatment options. Detecting a PFO in someone who has had a stroke, especially when no other cause is found, can be very important. If a PFO is identified, doctors might consider closing it or using blood thinners to prevent future strokes. But not everyone with a PFO needs treatment. Many people live without problems, and the decision depends on individual risk factors. The bubble study is generally safe, but like any medical procedure, it has some risks. Rarely, microbubbles can cause transient issues, but these are very uncommon. Proper patient selection and careful technique help keep the procedure safe. In summary, a bubble study reveals a PFO by injecting microbubbles into a vein and watching for their passage from the right to the left side of the heart on ultrasound. If bubbles cross through an opening, it shows a PFO that could allow clots to bypass the lungs and cause strokes. This test is a key part of stroke diagnosis, especially when doctors suspect a paradoxical embolism. Always remember to consult healthcare professionals for personalized advice and treatment options.